Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and today we are going to talk about heat. The summer is here, and a lot of people are headed to the beach. Kids are in the field playing soccer, baseball. One thing we need to keep in mind is the heat. I live in Houston, and Houston is known as the humbug city. You know why they call it as humbug city? Because of heat, humidity, and bugs. Let's just focus on heat and humidity for right now and learn something about heat and the effects of heat that sometimes can be very devastating and it could be life threatening. So let us start off with a simple example. Just imagine a 20-year-old young boy collapsing on a baseball field. He's dizzy, he's weak, he's extremely sweaty, he's got a weak pulse, his temperature is like 105 degrees. Immediately, the team members and the coaches rush and transport him to the emergency room. And in the hospital, his blood pressure is barely palpable, and his pulse is like 120, and he's sweating profusely. He's almost unconscious. They immediately hook him up to an electrocardiogram machine, start an IV, and pump 1 to 2 liters of fluids, and put some cold towels, and replace that with a cooling blanket. Well, ladies and gentlemen, I was describing a case of a heat stroke, which can be life-threatening unless immediate action is taken. Time is essence, and more importantly, understanding the effects of heat on human body is extremely important for the parents, for the coaches, for the instructors, and for the children, so that you know exactly when to act and when to seek immediate medical attention. Talking about heat, most of us talk about the temperature. Oh, it was 110 degrees today, it was 105 degrees. But there's another element that we need to keep in mind, and let's look at that. Here is a chart showing temperature and humidity and the so-called heat index factor. The heat index factor is how you feel given a temperature combined with a given relative humidity. And this is very important because I come from Houston, and as I already told you, Houston is known as the humbug city. That's where you have humidity, heat, and bugs. Let's leave the bugs aside. Let's look at this chart, and for example, if the temperature outside is 96 degrees and if the humidity is 40%, it may feel like a heat index of 101. But on the other hand, if the temperature is 96 degrees and the humidity is 75%, in the same setting, the heat index will be like 132 degrees. It is like you're feeling the heat that is 132 degrees. Now combine that sitting inside a car with windows closed, the heat index factor could be like 140 or 150. Your body responds very, very differently depending on the heat index, more so than just the temperature or the humidity alone. There are 3 types of heat-related problems. The simplest one is, of course, the heat cramps. The intermediate one is the heat exhaustion. And the most dangerous one is the heat stroke. So heat cramps results from electrolyte imbalance. People may get muscle cramps, they may feel weak, they may feel tired, and they may feel dehydrated or dry. To prevent heat cramps, it is very important to make sure you're fully hydrated with not plain water, but with electrolyte water, such as Pedialyte or Gatorade, so that you are not only replenishing the water but also the electrolytes. It is the loss of electrolytes that causes muscle cramps. You should take regular intervals of rest in a shaded area. Watch for more serious symptoms of heat-related complications like dizziness, weakness, exhaustion, or like lack of muscle strength. The second form, or a little more advanced form, is the heat exhaustion. The symptoms of heat exhaustion could be heavy sweating, weakness. The patient may look cold, pale, with clammy skin. The pulse may be weak and fast. The person may feel nausea, or the person may be even vomiting. As the dehydration progresses, the patient may feel weak and dizzy, and sometimes they can even faint. What do we do under these circumstances? First thing is to move the person to a cooler location. Let the person lie down and elevate the legs so he can improve the blood circulation to the vital organs such as heart, kidneys, and brain. Remove all heavy clothing. Apply some cold towel to bring down the temperature. If the person is vomiting, don't give them any fluids by mouth and seek medical attention as soon as possible. Again, to summarize, if you see a person with a heat exhaustion, elevate the legs. By elevating the legs, you're bringing the blood towards the body so that you have adequate circulation to the heart and brain. Apply cold compresses to bring the temperature down, and maybe use a fan to cool off the body, and let the person lie down on the floor to prevent from fainting. The next form is the heat stroke. This is the most dangerous one. In heat stroke, the body temperature goes above 103 degrees or 105 degrees. I'm talking about the core body temperature. That's the temperature inside the body. The person may feel hot, red, dry, dehydrated. Again, the pulse may be very weak and rapid, and sometimes the person could be unconscious. How do we treat these patients? Call 911. What did I say? Call 911. This is a medical emergency. Move the person to a cooler environment. Reduce the body temperature with cold cloths. Use a fan. Elevate the leg and transport this person to a medical facility as soon as possible. The most important thing in a heat stroke is to call 911 and then start some prompt treatment. Prevention is the best cure for any disease, and it is equally applicable in heat-related symptoms. I think every child, every parent, and every teacher and instructor should be given a lesson on heat and heat-related problems at the beginning of the summer or just before the summer begins. Beware of heat-related symptoms like the ones we talked about: muscle cramps, weakness, dizziness, feeling hot, feeling dry, feeling thirsty, feeling nauseated. In most circumstances, we should avoid extremes of heat. It may not be a good idea to play a very competitive sport in a very hot, humid weather when you can play the same game in the early hours of the morning or in the late evening hours. Whenever possible, wear loose ventilated clothes so your body can dissipate the heat and get rid of the excess temperature. Always, if you are on the beach, make sure you use suntan lotion to prevent excessive heat causing problem and also prevent some sunburn. Another important thing I would like to mention is if you're on the beach exposed to extremes of heat and humidity, don't drink alcohol because the alcohol can make your dehydration worse. You can get into more serious problems from the heat and humidity, especially at the beaches. Always replenish your electrolytes along with your fluid intake. If you have heart problems and if you are taking water pills, you may need to adjust your medications based on the heat and humidity because you may be perspiring more than usual and you may have to hold off your medications. A word about car. I already talked to you about the heat index. The heat index inside a car with the windows rolled up is going to be considerably higher then the heat index outside the car. This is an important factor we need to keep in mind. That is why we see and hear from time to time that children left inside a car in a hot and humid weather are most vulnerable to heat related symptoms. So when you get inside a car, make sure you lower the windows, turn on the air condition and the fan to a medium or high speed to blow all the hot air from inside the car so that it would be much more comfortable once you start driving. Well, ladies and gentlemen, this is a short synopsis of what is heat, what is humidity, what is heat index, and how it can affect us during summer, how to be knowledgeable about these heat related symptoms, and how to deal with them if you ever get into a situation where you or someone else is having heat related illness. Well, ladies and gentlemen, I am Dr. NIK NIKAM. You have been watching Triple N Media, and please do subscribe to our YouTube channel. And we also have a social media page which is Nano News Network or Triple N Network, where we keep you abreast of what's happening in and around town, and we would like you to please visit that page and like it. Until next time, I am Dr. NIK NIKAM for Triple N Media. Please do subscribe to our YouTube channel. Thank you so much.